Hello there, very good morning to you. Thank you so much for staying with us here on the AM show. I'm Bernice Abubedu-Lansa. Earlier you saw my colleague Benjamin Akapo engage in our guests on the issues of illegal mining and the latest on Professor Frimpong Boateng's report that found its way into the media space. Well, it's now time for us to talk about malaria. Yes, findings from the 2022 Ghana Demographic and Health Survey shows that malaria prevalence in children aged 6 to 59 months, that's just about 5 years, is 8.6% according to microscopy results, and the prevalence in rural areas is about 3 times that of urban areas. In Greater Accra is 2.0%. That region has the lowest prevalence, followed by the Western North and the Volta regions. And this morning, I'll be engaging my guests on the goal, which is to ensure that we are malaria-free. What exactly is causing the numbers that we are seeing, and how can we deal with that situation? And let me welcome in studio, I have David Delatham Tete, right? Pharmacist with Bliss GVS Pharma. They've been doing a lot of work in that aspect, and he'll be sharing with us what their goal and ambition is. I've also got Dr. Fred Adomako Boateng, who is the Bono East Director of Health. We also have Dr. Peter Techi-Pepra, Director Field Operations at the Ghana Statistical Service. And because we want to kickstart based on the statistics that we have, let me start with you first, Dr. Peter Techi-Pepra. What exactly is causing these numbers we are seeing? Why do we have the prevalence rate in the rural areas, at such a high rate compared to urban areas?
Hello?
Hello, Mr. Techi-Pepra, did you hear me, please?
Yeah, could you please repeat your question?
I was asking what exactly is accounting for the numbers that we are seeing in terms of malaria prevalence in urban and rural areas.
Well, the why question will be difficult to answer. We all know that Ghana is a malaria endemic zone. The National Malaria Control Program has put in measures to reduce or possibly eradicate malaria in Ghana. There are so many interventions, including encouraging mothers or pregnant women and children under 5 to sleep under mosquito nets. The next question we need to ask ourselves is, do they really adhere to that in their homes? You can really advise, but whatever practice that they carry out in our various homes is a bit difficult to track. So I don't know whether one can conclude that the rural area people are not really adhering to it, or mosquitoes are more prevalent in the rural areas compared to the urban. Because if you look at the breeding of mosquitoes, usually bushes and stagnant water contributes to that. So if we are to do some guesswork, one can really link to what I've just said. But the study didn't look at why. We rather measured or looked at the prevalence. That's why we've got to know that of rural is relatively higher than urban.
Statistics can you share with us with regards to your study on malaria prevalence?
The study, in fact, is on 2022 Demographic and Health Survey, of which malaria was a component. Even though the main results is not yet out, we try to extract that of the malaria due to this day, that's today, being a special day so far as malaria or World Malaria Day is concerned. So from what we have seen, at the national level, malaria prevalence among children under 5, that's those between 6 months and 59 months, in terms of malaria parasites, which the blood sample was tested at the lab, gave us a figure of 8.6% compared to the previous ones that Ghana recorded. So one can say that malaria prevalence is dropping. That's malaria prevalence among children is dropping.
Good news, right? Okay. I'll have you hold on. Let me bring in Dr. Adomako Boateng. He is in the Bono East region, the Director of Health there. So share your story with us. We've seen that generally there's a decline, but when we compare the rural and urban areas seem to still be struggling with dealing with malaria. Tell us what the situation is in the Bono East and what you're doing differently.
Okay, so basically, the figures are showing the prevailing environmental conditions when you compare the rural and the urban areas. If you really look at the way that the parasite is transmitted from the mosquito to man, and then looking at where the breeding sites for mosquitoes especially, if you look at our rural areas, you will see where the empty cans are just littered around. You have a lot of bushy areas. You have a lot of water is collected around almost everywhere. And because of that, typically, you have a lot of breeding sites for the mosquitoes. And since you have a lot of breeding sites, you are going to have, in terms of numbers, more in the rural communities. We can also look at the way the rural communities, the children play compared to the urban. You see, the rural communities is likely to have a lot of children playing out as compared to the urban areas, where you have a lot of the children indoor and then sleeping under other mosquito nets. And then even when they have to eat the mosquito nets, if you compare the setting up in the rural and the urban, you see that it's more feasible in the urban as compared to the rural areas and the other things that you do. So you will see that the conditions that favor the breeding sites for mosquitoes, and therefore the numbers are higher in the rural areas as compared to the urban areas. In fact, if you look across the country, some of the districts and cities that are doing very, very well are the very urbanized areas where the transmission of mosquitoes are low. So in terms of the reason why the rural areas are having much prevalence as compared to the urban area, you just look at the transmission cycle, and then you see in some parts of the rural areas, it's not a hard thing for children to come out and sleep even out at night, exposing them. In terms of other things that people will use, money, I mean, people in town can buy repellents so that when they're even going out, they can apply repellents, and that will repel the mosquito from biting them. So,
Doc, could poverty be, because I mean, it's we don't have the why, because Doc just told us that wasn't studied, but could poverty be a reason why we're seeing these numbers?
You cannot exclude that. I mean, if somebody has built a very nice house as compared to somebody who is not having that, in terms of the windows, in terms of the doors, even having a mosquito net or nets around your house, you will need money to do that. So we have a lot of factors contributing. In fact, poverty is one of and you know, the poverty will trigger a lot of cascade a lot of reactions. Therefore, that will lead to us having that. Even to the extent that if you have money, you know that you can even use treated nets for your net and all those. So poverty is also one of them. I mean, poverty is implicated in almost every disease that is known.
Doc, I'll come back to you. Let me come to the studio now. World Malaria Day this year, the theme is invest, innovate, and implement. And I see that Bliss GVS is doing a lot in that regard. And David Daladem Tete is here to share that with us. Why are you so interested in malaria as an organization, and what have you done to help us achieve zero malaria?
So Bliss GVS Pharma is interested in malaria, particularly because Ghana is has over the years been suffering from the malaria burden. It is actually reducing productivity in the country, and we see the need to help combat this disease because we want to improve lives, we want to improve people's health, and we want to see to it that the productivity in the country increases because we are trying to build a better Ghana for the next generation.
And when you say you consider this important, what are the practical things that you have done as an organization to help us achieve zero malaria?
Okay, so Bliss GVS Pharma started this initiative called the Act for Africa initiative. And this initiative is to help reduce the malaria burden, thereby donating medicines to some facilities and also creating awareness by educating health professionals and some stakeholders across the country.
I saw a story recently about some places you went to, the whole teaching hospital, the
Yes.
Tamale teaching hospital.
Yes.
You've been in quite some areas across the country. But, you know, when it comes to pharmaceuticals and medication, people are sometimes skeptical because of all the theories. You have just said that this is important to you, you're donating free medication, but what's in it for you? What is it that is pushing Bliss Pharma to make such huge investments?
So it's part of our corporate social responsibility as a company, you know. So what we are doing is our responsibility, or to say our obligation as a company, and it's a way of us giving back to the community for receiving us, coming to Ghana and helping them to have free access to medications, improve their lives daily.
Right. So Bliss GVS produces medication, right?
Yes, yes.
And we recently heard about the Oxford vaccine, and everybody is excited because, you know, I recently had malaria,
Okay.
and I thought it was COVID because it knocked me down. I have never had malaria like that before, and when I went to the doctor and they said, let's test for malaria, I said, are you sure it's not COVID? Because I was cold, I had a sore throat, I had a terrible headache. And so malaria is really serious. And if you're not aware, malaria still kills people, unfortunately.
Yes,
That's the sad truth. People die from malaria.
Yeah.
So hearing about the vaccines excited me. Obviously it's for children, but at least it shows the level of improvement or the level of achievement we've gotten to as a people in terms of dealing with malaria and eradicating it. Is Bliss GVS doing any work in that regard, looking for long-term medical solutions? Is that something that interests your company?
It's an interesting venture, like you mentioned. My company is more focused on producing medicines to help reduce the burden. So we are pioneering the production of antimalarials, and we are pretty much doing well so far. And our antimalarials are helping the mass. So we are, for now, like I said, focusing on the medicine production.
Okay, when you decide to produce vaccines, let me know.
Definitely.
But Dr. Adomako Boateng, again, recently we heard about Stefan Sai. Okay, and everybody was wondering, what is this? You know, is this going to wipe us out? And we had we had it on the front pages. You know, these mosquitoes that had migrated from Asia were now seen here in Damsuman. There were concerns about it being aggressive, not, you know, responsive to the insecticides that we have. Are you concerned that this will derail our efforts, or from where you sit and from the information you have, do you believe that we are doing something, you know, proactive so that we don't have, you know, a decline in the positive strides that we've made?
Thank you. So just to take it, we have a lot of intervention.
Hello, Doc? Oh, too bad we lost Doc there. Okay.
Interventions that we are having as a country.
Okay.
So we can even start, I can mention some of them that we have when it comes to malaria. This to tie to the team, and I'll come to the first mosquito or the new kid on the block. So we have even for what will target the mosquito itself? I'll come. So what do we do to target the mosquito? One, you can target them from not multiplying or breeding. So you can attack the source. And that is where these water bodies will come in. And we know that the mosquito breed that we're dealing with initially was breeding in fresh water. Now the latest one that we have now can also breed in dirty waters. So that is what is adding on. So if all your interventions initially was targeted towards only fresh water, now you have to make a room for dirty water. And that comes back to sanitation and hygiene, then environmental. So you see that though it's the latest one, it used to be in Southeast Asia, now it's coming. The way that we will have to address it is not quite different from what we already know. And so the other one is also when you use the barrier method so that you are not bitten by the mosquitoes. In that case, we are talking about the insecticide, long-lasting insecticide-treated nets and all those. So the first thing that we will have to do as a country is looking at the breeding sites to target the vector that is already there, and also to prevent the target from the vector from getting to us. So we just have to strengthen what we were doing. They come back to behavior. Initially, when people were giving the mosquito nets, people were giving all reasons why they wouldn't want to sleep under the mosquito net. This is the time that we really have to revisit sleeping under the mosquito net, because if you really do that, then we'll be able to pick it very quick and be able to prevent us from getting the disease. So these are the things that the National Malaria Elimination, actually it's not National Malaria Elimination Program. They have moved from control, and I think at appropriate time, the team will talk about it. So it's no more about controlling malaria now. It will come to a point whereby you don't even have any transmission of the plasmodium that causes the problem. So that's what we are thinking about. So if you look at the team for this year, when they talk about this is the time to invest, time to deliver zero malaria, time to invest, innovate, and implement. What are we supposed to innovate or invest in? Invest in research, long-lasting treated nets. We invest in research that we can even make the mosquito sterile. In other countries that mean that.
Right.
These are all research that we can think about as we invest in malaria and the time to deliver zero malaria. Look, if the plasmodium parasite, which is in the mosquito, is eliminated, you don't have any transmission. The reason why we get malaria is that it's not the plan or the purpose of the mosquito to give you. It's coming for blood. It's just coming for the blood. So it is coming in attempt to take blood, it will give you the plasmodium and then consequences of its action. So if we can clear the plasmodium parasite in all mosquitoes, they can bite 300 times. If you don't have the parasite in them, you can't get malaria. So it's time for us to invest. And it's not only us, the philanthropists, the global community, all because malaria, the burden of malaria extends more than the disease, the social and other financial implications. So if you ask me what NICET is bringing on board, it's for us to change our behavior to mitigate them. One thing that we also know that, look, if at some conditions, the malaria parasite or the vector cannot change from one state to another based on the condition, I don't want to go into that. But
right.
This one, it can do at high temperature. What do we do? There are ways that we can address some of these issues. So whatever this new kit is coming on, we have the arsenals to deal with them.
Can't we just, Doc, I remember in a conversation a friend said, why do we even have mosquitoes? Can't we just make them go extinct? Like, can't we just do away with them? Because I mean, isn't that an easier route? I'm just thinking, yeah? Doc, isn't that, because we're investing so much money, you're just talking about research, you're talking about, making them sterile, and I came across a study somewhere in Asia where they're doing that. They're sending the sterile mosquitoes to go out and then, exterminate or deal with the ones that carry the plasmodium. So if eventually there will be mosquitoes, but they won't carry plasmodium that will give us malaria eventually. But can't we just make them vanish? Isn't that possible?
So let's innovate. Let's invest in this research. How do we go about it? Because when it comes to malaria, it's not only Ghana that we should be thinking about. The mosquitoes don't have any boundaries or barriers. Surrounding countries, the sub-Saharan Africa and all those, we all have to come together because, mind you, look, this mosquito that we are talking about, where did they come from? It's coming from Southeast Asia. And unknown to most of us, it's not only the Anopheles mosquito that causes the female Anopheles. They have different breeds. If you go in, there are a lot of different mosquitoes that we cannot see with our naked eye. They are all there, even across political zones in the country. It's not all prevailing, it's not only one species that's the dominant species. So how can you invest, innovate, make sure that the plasmodium that is causing it, can we eliminate that plasmodium so that the mosquito can bite at 100 times, we don't get the malaria? These are all the things that we can think about. If you want to spray and kill all the mosquitoes, do you know the other things that other harm that you can do to the environment and disturb the food system? So all these we will have to think through research and then make a lot of investments. It's very key, and we have to really make a lot of investments to innovate. One of the things that we do for pregnant women is also to give them anti-malaria. Fancy that in some time so that they don't get the burden. We are doing a lot so that people who are high risk of getting the malaria are.
Doc froze again, unfortunately. But David, when I was talking about making mosquitoes go extinct, I saw you smile. Isn't that another way we can just deal with malaria once and for all?
Yes. It's another way to deal with malaria. I came across a research last month that was talking about this same issue. And the research was saying that they are not going to go all out in eradicating the mosquito because they are afraid of what they might create when there is no mosquito in the...
Are mosquitoes important?
They play a part.
in the entire ecosystem, eh?
Exactly.
They have a role to play, okay.
Yes, they play a part in the ecosystem. So the researchers are also not very keen on going all out to eradicate it. They want to some people also use this as a venture to generate revenue, so whilst they are into the research, into helping reduce the malaria burden, they are trying to find what they can create to combat that or just curb that or just overshadow this whole malaria issue. So it's an interesting thing to look into. But let's see what happens.
Let's see what happens. Let me just wrap up with Doc on that, Dr. Tichi Papa. So Doc, I mean, you've been listening to the conversation. Basically, the research is what you shared with us earlier. But what are your general thoughts on malaria and our steps in achieving zero malaria?
Thank you very much. I think I've listened to the discussions happening across, and one thing that I can say is more of the intervention. As maybe there is a need for us to intensify our awareness creation on the use of treated mosquito nets in our homes. I think it will help us a lot. And there is one aspect that we maybe I would say we have overlooked. We have refuse dump sites in almost every locality, but that of the rural areas, I would say, are most often closer to the settlements. So if we see malaria prevalence relatively higher in rural areas than the urban, Then one intervention I think we can put in place as a country is to also target such sites and spray the area on a regular basis. Possibly it can eradicate the breeding of mosquitoes at such areas, where definitely indirectly would have positive impacts on the reduction of malaria prevalence. So I would touch on this too, and I think if we add the other interventions to these, we can make a headway as a country to eradicate malaria, possibly 2030 that we have set as a target. Thank you.
Thank you for your time. And looking at the statistics, Dr. Adomako Boateng, this was a story done by the GNA on the 20th of January this year, 2023, and they were sharing malaria statistics from 2022. Now, Ghana recorded 3,745,398 malaria infections. These were confirmed ones. It was from January to September 2022. And this is data coming from the National Malaria Elimination Program. Unfortunately, 120 of that number died. But it was a dip in the earlier year, from the earlier year 2021, 196 people died. It appears that we're doing more in preventing deaths from malaria, but infections are still very high. 3.7 million, that's almost 4 million. That's quite a high number, isn't it?
It is.
So it appears that our efforts are all targeted at, preventing people from dying from the disease and not necessarily preventing people from getting infected. I agree, in 2021, the number was about 4 million. Now it is 3.7, also a reduction. But how do we ensure that infections also reduce significantly?
So, and that's the discussions that we are making. But I will have to emphasize now that nobody should die from malaria.
Right.
Nobody should die from malaria in this contemporary world. Look, the research that has gone into malaria, the effective medicines that have gone into. You remember, it came from chloroquine to artemisinin to artemisinin-based combination therapy. We had lot and lot of drugs. The question is, how do we manage the fever? We'll come to that. I will address the question. And access. So why should people die from malaria when they are effective drugs? One, maybe late reporting. It's possible. We will have to break these cases down to look at who is dying. And it's basically the under 5 and where they are coming from. So apart from what has gone in, and that's why it's important that we innovate and implement. The innovation comes from the geographical area that you are in. The regions are not the same. Greater Accra, Ashanti region, Central, Bunu East. So the evidence is clear. But if you don't innovate in the implementation of the evidence wherever you are, then you are going to have the deaths that we are talking about. So nobody should die. And therefore, it's important that wherever you are, you have to innovate. We shouldn't leave this only to the health workers. All of us should come in to pay our part. Because if you are living around, as we said, places where you have a bushy area, creating an environment conducive atmosphere for more breeding sites, then it's likely that you are going to have it. And not only that, even there are tested methods of preventing people from getting it. So how come though we have prevented methods from people from getting it, we are still getting the bites, and we are still? It means that there is small behavioral issue over here, attitude that we will have to address them. So the control, and that's why I believe that the National Malaria Elimination Program want to move away from the control, and so that we eliminate, and that is the catch, eliminate that malaria, that plasmodium parasite. So why should people be dying from malaria? No, in this time, it's not acceptable. But we have to know that we have a lot of vulnerable groups, especially pregnant women and children and are horrified. They are at risk. So if you see, we have a lot of intervention. And I will tell you that in Louis, we have one intervention that we are doing in 5 of the districts, which we call the seasonal malaria removal prophylaxis, where we give every child under 5 years Fansida, June, July, August, September, and we are thinking of increasing it to October, where we give them drug that we call Fansida and Amodaki, clear, because at that area, at that season, because of the rainy season, you have a lot of breeding sites and you have a lot of children getting it. So there are a lot of interventions at play. And the whole idea is that you prevent people from even getting the malaria. But once you get the malaria, we have a lot of tested drugs. People can start the drugs when they are feeling okay, oh, I'm done. And then they don't continue. So there are a lot of factors that will contribute.
Too bad we lost Doc again. But I mean, we're just wrapping up the conversation shortly. But when he spoke about medication, then I perfectly appreciate why Bliss GVS and others like you are here to help in the production of medication to help us deal with malaria. But he spoke about something about people not finishing medications and how over time, I know it's with antibiotics. I don't know if it works for malaria medication as well, because I have learned that when you take antibiotics over time and you don't finish your course, they begin, the bacteria begins to develop a resistance, right? So after a while, you may, and it doesn't affect you just as an individual, right? Because when we are a lot of people, then it means eventually the bacteria that is transferred from me to you to others through whatever means become resistant to the medication, and then we can't deal with it with the known medication, and we have to develop new medication. So on that score, what would your advice be to people who patronize your medication? What is the proper way of taking medicine, and what is the proper way of reporting illness as well? Because he touched on that.
I would want to start with this, that different people experience different symptoms when it comes to malaria. But then that's notwithstanding, there are general symptoms that everybody will present with. So once you start presenting with these symptoms, make sure you just report to the community pharmacy, get tested. It may or may not be malaria. And once it's malaria, they start you up on the treatment. He mentioned something very interesting. I would also wanted to add a little bit on that. Easy access to medicines is also very important, because what is the point if I present with these symptoms and I don't have easy access to the medications? So that is where we have the Act for Africa initiative running. And so we want to make medicines easily accessible to everybody, so that once you present with the symptoms, you can easily get it from any community pharmacy or over-the-counter medication, over-the-counter shops or chemical shops, and then start getting your treatment.
Thank you so much for your time here this morning. David Tete is a pharmacist with Bliss GVS, and they produce Lonat, right?
Yes,
Lonat malaria medication, and they've been doing a lot of work across the country distributing medicines. I know about the Tamale Teaching Hospital, I know about the Ho Teaching Hospital, and a couple others. And that's why this morning we're having that conversation with them about achieving zero malaria. It's World Malaria Day. The theme is invest, innovate, and implement. Earlier, you heard Dr. Fred Atomako Boateng. He was making such a salient point. Unfortunately, the internet. Okay, he's back, Doc. So just in a minute, you were talking about how people treat fevers for malaria. I'll just give you a minute to do that because it's important. David just spoke about timely reporting of illnesses, and the most important one, get tested first, okay? Test for malaria before you start any medication. But Doc, briefly on how people treat fevers, right?
So for now, National Malaria National Malaria Elimination Program, one of the things that we have done across the country, we have what we call rapid diagnostic tests. It's in almost every chemical shop format. So anytime you think you have malaria, if you think you have malaria, walk into them, any of them, and let them test you. Because the fever can be due to anything. So if you really think you have malaria, walk into any of them, and then once you are tested, if it's not malaria, please don't treat malaria. Because of a lot of interventions that National Malaria Elimination Program and the government have put in place. If the fever, you are having a fever, and the rapid diagnostic test is saying negative, don't think it's malaria. Don't say, I know this malaria. This is my malaria. No. They have moved away from that. So that's the key thing that I will talk about. That any fever that you think is malaria, wherever you have access to test, please take it. And drugs are also available almost across everywhere. If you don't have access and maybe a history has been taken and you think this is malaria, complete your medication. Complete your medication. Because for most of us who are more than 5 years, we have what we call partial immunity to malaria. It's very highly unlikely for us to go on to the complicated malaria, which is severe. Once you take your medicines, you are okay with that. So that is how you have to take fever. And it's important because we know nowadays a lot of diseases are coming. And almost every disease will present with fever. Almost every disease will present with general body weakness, headache. So in your mind, you think you'll be dealing with malaria. For all you know, it's something else. That's why it's important that let's test all the fevers as much as possible before you treat for malaria. Let's invest in malaria because it's time for us, for all of us. I know people for 20 years, they have not gotten malaria. 20 years, they have not treated malaria. So zero malaria is possible for all of us.
Thank you so much, Dr. Fred Andromako Boateng. And when you were talking about presenting with similar symptoms, I just remembered my situation when I thought I had COVID, but instead it was malaria. It was terrible. I think I had COVID once, but the malaria was worse. I don't know where I picked that malaria from. I don't know what kind of malaria it was, but since that day, if I see a mosquito, I kill the mosquito with everything in my heart. Anyway, thank you so much, Dr. Fred Andromako Boateng, for joining us this morning. And thank you, David Deladem Tete. He is a pharmacist with Bliss GVS Pharma. They're producers of Lunat, and they've been doing a lot of work in helping us achieve zero malaria. They've been doing the Act for Africa as well. So thank you, Bliss GVS, for all that you do. And also, let me show my appreciation to Dr. Peter Techi-Pepra, Director of Field Operations, Ghana Statistical Service, who shared the statistics with us. That was our launch pad for the discussion. Well, it's now time to get interactive with you. Benjamin Akapo joins me shortly. Do stay.